Before the program, I prayed a lot. I didn't have any insurance of any sort.
If something was wrong, I would just let it go, and I would just kind of put a Band-Aid on it and try to fix it myself. So
I think we're providing a service that hasn't been provided in the past. There are services out there for folks who are uninsured, but the programs that are out there do not reach everybody.
When they leave there and I can say you're accepted into our program, they're just so delighted, and it just makes you feel really good.
I've had people do everything from completely break down and weep because they've wanted situations where they can get and see a doctor and just haven't been able to afford it.
About 4 years ago in the First Presbyterian Church, I'm a member of a committee called the Social Education and Action Committee. And we would have a study for a whole year on a various concern in the community. And one of the concerns brought to our attention was the lack of health care, access to health care by the working poor in our community. And of course at the time, we weren't really aware that there even was a problem.
We asked doctors to talk about their experiences trying to care for patients. We talked to people in social services, and we had these panel discussions. And once that happened, we had enough consensus in the group that there really was a need here, that we needed to act.
After the first year, we called together many people from the community, from the health department, from Northern, from the hospital, from the county, from all over the community. We asked people to participate on this committee to research it further and see what we might be able to do as a community in action. And it was just very humbling because when asked, no one said no.
We asked people that already had some indication that they knew that there was a problem. And usually people know there's a problem, but they don't know what to do about it, so they feel kind of helpless. Well, we had a possible solution, and it looked doable, and we knew there were other people that had done it. And so people that really care, if they think there could be a solution, there's several of you working on it, of course they want to join in too. They know that they can do something to help.
People got on board who were really expert in this very difficult and fussy field of detail and legalities and all kinds of particularly pharmaceutical questions. So this committee just stayed in dialogue, and it was amazing how this committee didn't grow. The committee began as a large committee. People just came to it.
First we met to organize. We decided what we wanted to look like, what it is we wanted to be. We realized we could just take this off a step at a time. We then opened an office at the Peninsula Medical Center. They were so generous. They donated an office for us, an office space.
This is really a partnership that's developed between physicians, who are at the heart of the program, and the hospitals, pharmaceutical companies and pharmaceutical representatives, and faith communities who are helping us raise money for pharmaceutical products. So, and the clients themselves and the community itself, who has embraced this program, and volunteers to help us be able to mount a successful access program.
It's part of our mission at Medical Care Access to treat people with dignity. And having that card means something. We have a card, just like a Blue Cross card.
Hey, how are you?
People's biggest concern is getting their medications.
People will call ahead, or they'll come in and they'll ask the price of a medication, and when we give it to them, they'll think about it and they'll hold off, and they say, well, we'll have to get it at another time. They really can't afford to get it at that time.
When the patients come in to get their prescriptions from the doctor's office, they don't feel different. They feel like they're just coming in and getting something like samples. You know, they're very grateful. You know, I've never met a grumpy patient who is coming to pick up their prescriptions. In fact, it's the exact opposite. They're all very appreciative because they know how much these medications cost.
Our doctors in Marquette County are very generous. They've seen patients for years for free, but getting medications is a problem because they are so expensive. So when they can walk in and get them, they feel so good and they're so grateful. And we hear the thanks that we try to pass along to our physician providers, to our pharmacists.
All of the pharmaceutical companies have come on board. It's not even questionable. It's what do you need and how can we help? And everybody has been that way.
Once people were contacted or people heard about it, it wasn't something where we had to be twisting people's arms or begging them to come in and join this. I really do believe that when people heard about it, understood what we were trying to do, realized the need that is present, that many people are willing to jump in.
It's always been easy for me personally to donate my care, and it was just a matter of getting things orchestrated. For example, in my profession, I would often see people with heart valve problems that would have poor teeth, and I would have to get those teeth taken care of, otherwise they would infect their heart valve and get a very serious condition and perhaps even die. So I would often have to call up my own dentist and ask him if he would please see these people. And of course he would, but it's hard to find time to do all that sort of thing, to call a dentist, maybe call a pharmaceutical rep and see if he would donate some drugs, or call another doctor, see if he would see this patient for free. It was just difficult to get all these things done, and that's the idea of this organization. It coordinates all that. All that is just automatic, just like it would be for someone with insurance. I mean, that patient is readily transferred to another doctor, can readily get dental care, can get the medications that they need. Everything is done simply just as if they had the best insurance in the world.
We look at it as part of the whole continuum of services that we have in our community. We have a very extensive medical care system serving Marquette County and the Central UP. And unfortunately, probably 10 to 15% of the people couldn't access it in the past because they didn't have insurance.
Oh, the clinic is an exciting thing. The clinic opened June 25th. And we have had full clinics since. We've had anywhere from 6 to 12 patients a night. The exciting part is that it's all done through volunteer physicians, volunteer nurses, and receptionists.
We realized that we had a limited number of primary care physicians who we could assign patients to, and that we would need to initiate planning of a clinic. And as we progressed, we added a clinic coordinator. We visited the free clinic in Traverse City, Michigan to see how they handled things. And then what is so interesting is that, like most communities, we adapted what we saw at these other places and we made something somewhat unique here. And
it's just so exciting to see our patients have access, and the patients are so grateful. They just are so grateful to be able to access health care.
Outside of the county, our efforts have focused on helping communities to see that they do have the resources that we do and that they can pull them together. And we also offer the services that we have, the methodology that we have, the computer software system that we have, which is designed so that other communities can tap into it. We offer that to the communities because we'd like to see this grow so that not only those folks who are left without medical care in this county, but outside of this county can get the help that they need.
Oh, they're great. It's a real energetic team who are very passionate about what they do, which is an absolute joy to train those folks and to see them just grab onto the vision of MCAC. It's very rewarding.
I just walked in one day and it said I'd like to volunteer. It was, I don't know what made me do it.
When you walk into MCAC, there's no please take a number sign, but a real person will talk to you and meet with you. All of our enrollments are done person to person. We don't pass out forms and have them just file them in some impersonal way.
They make it very easy. They feel, they make me feel as if I'm not lesser than anyone else being in the program. My husband is disabled, and I kind of fall through the cracks when it comes to medical insurance. I stay home to take care of him, and therefore, with not working, I can't afford the price of going to the doctors and or insurance. And it has helped us tremendously financially. I can't say enough good things about it.
The Marquette County Health Department has a dental clinic that has treated low-income and Medicaid patients for a few years now. Medical Care Access Coalition was able to integrate with them and provide funding for the clinic to treat some of the MCAC patients, in addition to the volunteer dentists in the community treating them.
When the Medical Care Access Coalition began taking in clients to be treated under their program, they saw that many of these adults needed dental care as well as medical care, and in many cases significant dental care and emergent dental care.
The dental program as we set it up is primarily designed for urgent dental needs. Patients who are in trouble. They have a swelling, they have an infection. But the dentists in Marquette County have been very generous, and so they've taken these patients on and treated them like any others. And so on many of them, if they've needed crowns or if they've needed a whole set of dentures, our dentists are providing that service to our patients. And so they're going one step beyond just taking care of the chronic or the acute need of the patient. They're looking out for the patient's total dental needs.
The mouth, when the mouth is unhealthy, it's a portal for bacteria to enter the bloodstream, and that can cause problems with heart surgery or joint replacement surgery, a lot of things. So having a healthy mouth definitely affects the rest of your systems.
Without the MCAC program, there's no question that many of these people would fall through the cracks and not get the care that they absolutely need in terms of reducing infection and pain in their mouths. And that's what I see as the biggest significance, because there are so many children and adults out there in the world that do not have access to care and who have not been identified as needing care, and MCAC has been instrumental in providing that in Marquette County and getting these people in and getting care for them.
Some patients have been very relieved when we can get them out of pain, start getting them healthy again, and it helps their overall outlook. One of the goals, I guess, of the MCAC secondary goal is to make patients more employable. And many patients, once their teeth are healthy and they can smile, feel much better about being in the workplace.
Like with physicians, we do track the number of patients we send to each dentist and the value of services that the dentists have donated to the program. This helps us in our grant writing and helps show the community involvement in Medical Care Access Coalition.
All that is needed is someone with a desire to make a difference, and their leadership and inspiration and charisma can build a program like MCAC in that county. So it has been not so much the need of finances, but just people who are concerned enough about the issue to make a difference.
This is what I've always wanted to do. I've always wanted to be someplace where I was helping somebody, and I feel like I'm doing that now.
I think the access to healthcare model will continue to grow. Hopefully it will hit a tipping point where everyone in America feels that this is just a #1 priority.
I believe the solution to this is in the hearts of the people in the communities. I think people really do want to give. I think people find out that they feel much better about themselves when they step outside themselves and help one another. And I believe our project does that. And we give people the opportunity to do that, to step outside themselves and help one another.